So, about psoriasis, the number one question is what are the variants of psoriasis? There are chronic plaque psoriasis, gutted psoriasis, then there is erythrodermic psoriasis, pustular psoriasis, and uh, that's about it. So, can you talk about these?
When talking of psoriasis, we think of a disease with squamous cells coming out of the skin from certain parts. Mostly they're extensors of forearms. In the scalp, a very bad type of seborrheic dermatitis. In the groin area also, some scales are coming up. Of course, on the knee joint or externally. And of course, you may be having palm and soles with psoriasis involved. And then you may be having face involvement psoriasis as well. A child may be having cough, snoozing, and vitamin E and T problems, and he comes out with psoriasis as well. A person may be having small points of psoriasis, which happen because of some preceding disease he may be having. And maybe some other members of the family also has psoriasis, but usually it's non-contagious from this point of view. And then you can reassure the husband and wife of its benignness and the nature of it. And then, if your body has more than 30% psoriasis on various parts of the body, you can say it is erythrodermic psoriasis. And then if the psoriasis involves small joints, niche joints on different parts of the body, you say it is psoriasis of the body as well as from the joints of the body as well. And then
can you talk about the presentations of...
Sorry, I'll be talking, sir.
Okay.
And if you find a young lady, pregnant or not, with small pustules on her body, it's called pustular psoriasis. And it may be coming to anyone, even without marriage or pregnancy. So this is a point which I wanted to say. If somebody wants you have to shake hand, you find the hand very crumbled, very dry and crusty. The patient may be having psoriasis as well of the hands.
What are the investigations for psoriasis?
Usually when you see psoriasis, generally speaking, the investigations are required? No. The investigations are required? Many. It all depends upon the type of the society you're suffering from. In certain societies, there is no psoriasis. In certain societies, there is a hell of psoriasis. Many psoriasis patients are there. And then, if you want to see clinically, you can diagnose it clinically as well. And if you want to see it for investigation, you can do a biopsy for it. You can do an ABC method techniques as well. You can do histopathology, you can do electron microscopy, and then you can do other investigations for this psoriasis. And then
what will you see on histopathology of a psoriatic lesion?
Okay, when you talk of psoriasis, please understand it. If I want to remove my skin, usually the skin is gone with around an average of 40 days. But if the skin is going away in the age of 3 to 4 days, very scamoid, and on the certain parts of it, it's very quickly going away in 3 or 4 days instead of 40 days, then it is having scamoid nature, psoriatic nature. And this psoriatic nature exhibits in the slides as well. You will see psoriasis type of psoriasis lesions on H&E stains.
Which is called ratty edges?
No, which is called psoriatic lesions.
Parakeratosis?
No, parakeratosis is a different situation. And then this is psoriasis presence of the lesions on H&E staining in any individual. This is typical of it. Of course, you may think of lichen plantar disease as well, but you have to know what is the clinical picture of the patient. Maybe you have a clinical photograph of him as well, and then you may be able to diagnose it clinically as well.
Okay. What are the treatment options? What are the topical agents? And what are the phototherapy and systemic agents for psoriasis?
Yeah, I think you have to be little quiet so I can answer your questions. Psoriasis, it depends. If it is only on the scalp area, you have to do some tar solution on the face. And then on the face as well, you have to use some tar solutions on the head and then on the beard area as well. If you have some psoriatic on in between the chest, in the axilla and the groin area, you have to use some tar solutions. Generally speaking, shampoos for this.
What about corticosteroids?
And sir, one solution. And then, if the hands are too messy, as well as the sore. People may use some steroid applications once a day, not twice a day, once a day or an alternate day, so that there is no side effect of steroids. And then the steroids may be coming to dermovate or betrovate type, and then they may not be psoriasis type. And then you have to be careful to avoid inclusion and body, so that you don't have any situation in which you get steroid lesions on the body. That is how we use steroids, generally speaking. Orally, usually steroids are not recommended to be used on a patient of this situation of lithodermic psoriasis. Small psoriasis can be used, but then you have to keep a record in the file of the patient. You have to tell the patient as well. Please don't run away, because we have all the data with you. If you want to go to another doctor for an opinion, we can give you a leaflet or an answer, patient sheet, so that you can see another doctor as well. And this is the reason, not cribbing the patient to us. We are telling him you can go anywhere, but please be careful. Have a complete record of what you are doing there. And now people have been using PUVA, ultraviolet A, along with Sorolins previously. But now they're using UVB, ultraviolet B, as a solution for psoriatiform lesions. That is called laser solution. And this is used there. You people may be using cryotherapy as well, even corti as well, but usually laser. Neuropend UVB is better than the other ones. And then you have to keep a record of the patient, how he is coming regularly or irregular, and what are the doses of Neuropend UVB, which you are increasing or decreasing according to the situation of the patient. And then people may be using some methotrexate once weekly for a patient. And then if the lady is a female, not married, and no other problem she has, she can use any one of them. But if a lady is married and there are chances of pregnancy, then you have to be very careful to tell her and her husband how precautions and taking care you have to take in both the situations. And then this is the important thing. You may be using some steroid.
What about vitamin D3 analogs?
And then you may be using with vitamin D3 ointments. If you use vitamin D3 ointments, you can use the combination of vitamin D3 and steroids as according to the situation, 50-50 or 75-25. Then you can gradually see the results. And then you have to avoid things on these flexual areas of the body.
Okay.
So that the patient is not having side effects and the patient don't know how much side effects he has it. You have to see regular investigations of the patient so that you know how the things are moving on his kidney, liver and other organs. And what's the benefit of this investigation which you have done to this patient. And what's your complete question?
The last part is, what about biological agents, infliximab, eternal?
Okay. When you talk of biological agents, the big fancy about these drugs. Oh, they can be used. And people are trying to use them. I think this vitamin A analogs were also used some time before as the last treatment therapy. But now there are so many drugs related to the psoriasis which are being used now. And then you have to take a record, maintain them in the way they have been told, and you can get a discount from the agent as well for some special patients. Then you have to keep a record that the patient come regularly to you. And then by this way, you can see the lesions and the response. And then you can read some CME article from a standard journal about the presence and working of these biological agents. And you have to follow some system. It's being prescribed and internationally used in those areas, so that you are not running away from the center treatment regime which has been practiced and which has some known side effects on human beings. So that's the reason people don't say rush and go to biologics. You should have a certain sedator type, medal type of system, how to go up and go down in any treatment method what you're using for psoriasis.
Okay. Thank you, sir. This is all about psoriasis.
It is welcome.